Dr. Merrill, hey, your 1020, I noticed, it has a history of hypertension, diabetes, and trouble managing her weight.
Oh, Mrs. Robinson? Yes, I've been working with her for a while. She has a lot of ups and downs, but I think overall she really wants to help manage her health problems better.
Oh, okay. Do you think it would be helpful for me to step in and create like a health behavior change plan with her?
Oh, that might work. She's coming in today, so I'll talk to her when she comes in.
Okay, great.
Hi, Mrs. Robinson. Thanks so much for coming in today. I wanted to go over your lab results. It looks like your blood sugar was still a little bit high, and your blood pressure today was a little bit high when the nurse took it too.
Yeah, I remember the last time I came in, about 3 months ago, you did mention that, so that was my main concern for coming in today.
Yeah. I know that you've been working on lowering your blood pressure and losing some weight, trying to get that blood sugar down. I wondered if it would be a good idea for you to talk with one of our behavioral therapists to help come up with a plan and some goal setting.
That sounds fine. Sure, we can try that.
Okay. Let me go see if she's here today.
Okay.
All right, Mrs. Robinson. So this is the behavioral therapist that I was telling you about.
Hi, how are you?
Very nice to meet you.
I'm Laura.
Hi, Laura.
Yeah, good to meet you. Mrs. Robinson?
Mrs. Robinson, yes.
So Dr. Merrill was just speaking with me briefly about you and just seeing how we can create a healthcare plan to reach your goals. I'm one of the behavioral health consults that she's mentioned. So hopefully I can just talk with you for a few moments about some of the things that she's discussed with you so far.
Absolutely. Sounds good. Yeah.
I'll step out and let you kind of talk for a little bit.
Okay, thank you.
So I'm wondering if we can create a plan using what's called SMART goals. Have you ever heard of a SMART goal?
No, but I'm interested.
Okay, great. So SMART stands for S is specific, M is measurable, A is achievable, R is relevant or realistic, and then T stands for time limited. Okay? And so this is kind of what it looks like here. I have a little worksheet that we're going to go ahead and fill out,
Sure.
as it relates to you managing weight, maybe even you becoming more active, right? And you mentioned the gym was one thing you're trying to do, so that would be also things we can incorporate into here.
Sounds good.
Yeah?
Yeah.
Great. And Mrs. Robinson and I had the chance to talk about some of the SMART goals. So her first one is to walk upstairs to work 3 times per week, which is great because her office is on the 3rd floor.
Wow, great.
Yeah. And the second one was to, instead of drinking soda and juice, she's going to instead drink water, and this is going to be 5 times per week. Yeah.
Wonderful.
Yeah. So really great because they're all measurable, achievable, relevant, and timely. And so the goal's important to her, as you already know, is because she wants to avoid developing diabetes and she wants to be around for her kids. Yeah, that's really important to you.
Very.
Yeah. So the benefits of achieving this goal is to just improve her overall health, kind of this quality of life that she's striving for, and again, to be around for the kids.
Absolutely.
Yeah. Some of the barriers, of course, as you can imagine, is one, there's a soda machine on her floor, but we said that the solution would be to not carry loose change around.
Right.
Yeah. And so the second potential obstacle is that the elevators come before the stairs.
Oh.
Yeah. So instead, what she's going to do, Mrs. Robinson, is take another route to go and hit the stairs first and to avoid passing the elevator for any temptation.
Right.
Yeah. Good.
Thank you.
And one person she identified, which is terrific, it was a coworker to help her join along this journey to help her reach her goal. So
Great.
Yeah.
Always easier with someone to help you.
Absolutely.
yeah. So what I like to do is maybe follow up with you in about a week with a phone call.
Sure.
See how things are going.
Sure.
Yeah.
Yeah. And then I think if you would follow up with me in a month, we could recheck some of your labs and check your weight and your blood pressure, see how you're doing as well.
Absolutely.
All right.
Yeah.
All right.
Sounds great.
Thank
Thanks
you.
for coming in today.
Thank you.